Okay, so ERA is the so-called endometrial receptor assay. And the reason for this having been developed, it's a PCR type molecular test of the endometrial lining with a biopsy to see whether the lining is in sync with the embryo. And I think it's very, very commercially based. It was really designed to be something that can be sold. And the reason physicians sometimes resort to that is it's sometimes a mystery. Why isn't someone getting pregnant when you're transferring perfectly good embryos? What's the problem? And it's one of the greatest controversies and scientific endeavors right now is it just the embryo was not viable, or was there some problem with uterine receptivity? For example, we know we have cases where we have perfectly normal embryos and the woman never got pregnant. She finally decided to use a gestational surrogate who had already had babies, and bingo, the surrogate is pregnant and has a healthy pregnancy. So we know that there are things like that happening. But we found the ERA doesn't improve things. It's just a matter of timing. It's not really a matter of saying if the endometrium is a good endometrium. It's a matter of trying to say, well, should we transfer it yesterday, today, or tomorrow? When should we transfer that embryo? We do mostly frozen transfers anyway. So we're not worried about the endometrial lining being out of sync with the embryo. If you're using a frozen embryo, then you know that you're transferring it in sync with the uterine lining. It's not a problem like if it's a stimulated fresh transfer. So I don't advocate ERA. Now, as to the mock transfer, mock transfers only have to be done if the physician doesn't know what he's doing or what she's doing, because we don't have problems with transfers. There's absolutely no reason on earth to do a mock transfer. The only reason to do that is if the physician feels, well, I want to know whether this is going to be an easy transfer when I actually have an embryo in it or not. And whether the transfer is easy or not often just depends on the particular day the transfer is being done. So the mock transfer is not only useless for doing a good endometrial transfer, but also it's a sign that the doctor isn't very good at embryo transfers. Embryo transfer needs to be delicate, and you need to have the right touch. And it takes years and years and years of experience to get that right. And of course, we use ultrasound guidance. But the ultrasound really doesn't visualize the cervical crypts that the catheter can get caught into. They're really so tiny, ultrasound doesn't see it. So ultrasound just is capable of showing us the catheter went into the uterus right. But the way to get around those endometrial crypts is touch, a very, very delicate touch. The ultrasound doesn't help you do that. And I think a mock transfer is the doctor isn't experienced, and so he's just practicing on the patient. And I don't think you want to go to someone who's just practicing on you. So that's my view about mock transfers.